Hello future doctors, welcome back to your trusted channel for high yield medical education. So myself, I'm Anand Jana here, 4th year medical student. Today we are decoding a highly trusted but often confusing pathological topic, that is amyloidosis. So we will break it down. We will break it down into like basic pathology and Congo red stain findings, all systemic and localized types, and some clinical scenario. Let's get started. First of all, amyloidosis. Amyloidosis is a group of disease caused by abnormal aggregation of proteins. Okay, so it's caused by abnormal protein aggregation. These proteins, like, are there proteins also are there, you can call fragments from it form insoluble beta plated linear sheet fibrils that deposits in tissues. Okay, so this, first of all, if anyone asking the definition of amyloidosis, means we have to tell it's a group of disease caused by abnormal protein aggregation. That protein will aggregate in some cells. So this protein are the fragments form insoluble beta, we have one beta plated sheet fibrils. So there you can see this deposition of the deposits in tissues. Okay, the key results of this deposition are, first one, cellular damage. Okay, the insoluble fibrils, it will damage the cell, it will do it because of this deposition. We can see cellular damage, and apoptosis means self dying and organ dysfunction. Okay, these are the things we can see in amyloidosis thing. So why can't the body clear them? Because they are insoluble and misfolded. If it's soluble, means the body will soluble that amyloid, that protein thing, and it will excrete with that waste materials. But here this is insoluble, so that's why it's very hard to excrete. Just imagine or think of amyloid as a toxic glue that damages organs wherever it gets deposited. Okay, so this is the easily you can understand with this thing. Okay, you have to think that is toxic glue that damage organs wherever it gets deposited. Okay, so how do we detect amyloid deposits? We can use the Congo red stain. This Congo red stain will it will find, because how we can use this thing means we can use this Congo red stain with visualized by Congo red stain, and its polarized light like apple green birefringence. If you are seeing this image, in this image you can see here, this is like it's you are seeing this thing in under normal light, its deposit stained red, and under polarized light you will see the classical apple green or birefringence, a hallmark features. Okay, on H&E stain, and next one you can do H&E stain for amyloid appears. Here in amyloid appears, we can as amorphous eosinophilic material. Okay, if you are seeing this image, you can see here this second one, you can see here, this image you can see in glomerular mesangial areas, like white areas. Okay, in the tubular basement membranes, like black, you can see here, this is black arrows. If you are seeing this black arrows, you can see here it's like tubular basement membranes. If you are seeing this white arrows, this it's like it's appreciating the glomerular mesangial area. Okay, so this H&E stain, if amyloid is accumulate, so in amorphous eosinophilic material we can see by H&E stain. Okay, so in Congo red, green glow under polarized light, you can see like this. Okay, next one. Now this amyloidosis, This amyloidosis we can divide into two, like first of all we are discussing about systemic thing. This systemic, there are three main types systemic amyloidosis. There are three main types of systemic amyloidosis. First one, primary amyloidosis. This primary amyloidosis you can tell that is AL. AL means it's like from immunoglobulin light chains. You can see this thing. Okay, the fibrils are made of immunoglobulin Ig light chains. Okay, it's seen in plasma cell disorders and like multiple myeloma. Okay, and some clinical signs. You can see some clinical signs include like cardiac. In cardiac you can see like its manifestations include like cardiac. In cardiac you can see restrictive cardiomyopathy and arrhythmias. And when it's coming to renal, in renal you can see like nephrotic syndrome. In GI macroglossia and hepatomegaly. Okay, so these are the things you can see in primary amyloidosis. Next, in secondary amyloidosis you can see here, in secondary amyloidosis you can see this is caused by serum amyloid A. Okay, serum amyloid A. So in secondary amyloidosis is caused by serum amyloid A and is seen in chronic inflammatory diseases. Okay, inflammatory diseases like rheumatoid arthritis, inflammatory bowel disorders, or irritable bowel disease, or familial Mediterranean fever. And organ damage includes we can say organ damage include like kidneys, nephrotic syndrome, and liver and tongue. In this liver and tongue mostly we can see like hepatomegaly and macroglossia. Okay, so next, third one is a dialysis and related amyloidosis. This dialysis related amyloidosis fibrils are made of beta 2 immunoglobulin. So this fibrils is made of beta 2 microglobulin. So it's seen in end stage renal disease. Okay, and on long term dialysis patients. So it affects mostly joints. In joints we can think about carpal tunnel syndrome. Okay, and nerves, that nerves can cause neuropathy. Next one, in hematological signs you can see like easy bruising, okay, and splenomegaly. Okay, so these are the things will comes in systemic amyloidosis. Next one, localized amyloidosis. In localized amyloidosis we can say like in localized amyloidosis we have 4 localized forms of amyloidosis. So let's discuss. First one, Alzheimer's disease. In Alzheimer's disease, the amyloid, or you can tell like a beta amyloid protein, it's derived from amyloid precursor protein. Okay, so it's found in neuronal plaques and cerebral vessels. Okay, so where it will found this thing, you can find this thing, you can found in neuronal plaques and cerebral vessels. Okay, next one, type 2 diabetes mellitus. In type 2 diabetes mellitus you can see amyloid, it's like islet amyloid polypeptide, or you can tell PIAPP. Okay, why it's because this amyloid, this protein is deposits in pancreatic islets and it will damage the beta cells. What it will do? It will damage beta cells. Okay, and it's mostly linked with insulin resistance. Next one, medullary thyroid cancer. In medullary thyroid cancer you can see here this amyloid, that calcitonin, like, or you can tell like amyloid you can mention that A, and cal means calcitonin. It's seen in amyloid stroma, in FNA or histology, where you can see this thing, this calcitonin you can see in amyloid stroma, in FNA or histology. Okay, next one you can see isolated atrial amyloidosis. This isolated atrial amyloidosis, this amyloid you can see an atrial natriuretic peptide, or you can tell ANP. In this ANP you can see like it's common in normal aging, and it increases risk of atrial fibrillation due to atrial remodeling. Okay, it will increase risk of atrial fibrillation and atrial remodeling. Next one you can see here systemic senile. You can see here this is systemic senile or age related amyloidosis. It's like normal, like wild type, and you can see transthyretin TTR. Okay, it's seen in predominantly in cardiac ventricles, and because of this thing you can see cardiac dysfunction more insidious than in AL amyloidosis. Okay, it's like very severe thing. Good. Next one, hereditary forms. In hereditary forms there are also inherited forms of amyloidosis due to mutated transthyretin, or you can tell ATTR means transthyretin. Okay, so in first one, familial amyloid cardiomyopathy. This familial amyloid cardiomyopathy, it's mutated transthyretin deposits in ventricular myocardium, and it causes restrictive cardiomyopathy or arrhythmias. It's seen in 5% of African Americas. It's seen in African Americas. Okay, it's seen in mostly 5% of Africans, and Americans are carrier of mutated allele. Okay, so that's why we call this is hereditary form. Next one, familial amyloid polyneuropathy. It's also due to ATTR. This like because of mutated amyloid mutated transthyretin. Okay, so it's also due to ATTR mutations caused by progressive peripheral neuropathy. It's treatable with liver transplant. Okay, this hereditary condition will be treated with liver transplant, because source of liver is the main source of transthyretin. Okay, so this is the main thing for amyloidosis. This is very high yield topic and very important for your exam view, because exam questions can made from this topic. Okay, so I'm going to give little like rapid review. Okay, for your it will help to do your MCQ solutions. Amyloid means beta plated misfolded protein. Congo red stain, it's like apple green birefringence, you can see. AL means primary or plasma cells. AA means secondary, and it can cause chronic inflammation. Next one, dialysis is you can see beta 2 microglobulin. Alzheimer's you can see beta amyloid. Diabetes type 2 you can see IAPP. And next one, thyroid. In thyroid you can see calcitonin. Next one, heart and aging. For heart, and atrionatriuretic peptide TTR. In tip, like bonus point, if you see macroglossia plus proteinuria, you have to think amyloidosis. Okay, macroglossia means big tongue, and proteinuria, in urine more amount of protein is passing, means you have to think that is amyloidosis. If you see carpal tunnel in end stage renal disease patient, then you have to think dialysis related amyloid. Okay, so this carpal tunnel syndrome is very common in end stage renal disease, so that time you have to think dialysis related amyloid. Okay, so that's the complete guide for amyloidosis, and I'm discussing these topics from first aid guide. Okay, I hope this video is helped and simplify the high yield concept. If you didn't subscribe my channel, don't forget to like, share and subscribe. If you have any doubts, you can ask me in comment section. We will meet in our next video. In next video we are going to discuss about cellular adaptations. So till that time, take care, bye bye.